Now let's focus on the latest update on COVID-19, and the Ethics and Anti-Corruption Commission says it has finalized investigations into the loss of billions of shillings at the Kenya Medical Supplies Authority. EACC Chairperson Eliud Wabukhala says the commission has handed over the files to the Office of the Director of Public Prosecutions for action. Wabukhala spoke on a day the country recorded an increase in the number of COVID-19 infections.
In September, a special audit by the Auditor General revealed that Kenya lost 2.3 billion shillings in the COVID-19 items procurement scandal at the Kenya Medical Supplies Authority. Since then, investigative agencies have moved in to probe the matter. The Ethics and Anti-Corruption Commission says it has handed over evidence to the Director of Public Prosecution after completion of the first phase of its probe into the alleged scandal.
We could not go for all of them at Ago, so we have a phased out procedure system that we finish this, then we go to the next until we finish. Everybody who was involved will definitely give account of what we did. But we have also recommended systems review of KEMSA, because they cannot afford to lose all this. If they had a system that is basically able to prevent those kind of loopholes.
KEMSA has in the recent months been castigated for its poor handling of billions of shillings meant to fight the coronavirus pandemic. On Tuesday, Kenya recorded 404 new coronavirus cases from 4,878 samples tested, pushing the total caseload to 92,459. The new cases translate into a positivity rate of 8.3%. The Ministry of Health also announcing that 527 patients had recovered both from the home-based care program and in various hospitals across the country. The total number of recoveries has now risen to 73,979, while that of fatalities rose to 1,604 after 11 more patients succumbed to the disease. The Ministry of Health says 871 patients are currently admitted in various hospitals, while 6,284 are recuperating under the home-based isolation and care. 46 patients are in the intensive care unit and another 11 are in the high dependency unit. The latest statistics come in even as the government says it has put in place mechanisms to ensure strict adherence to COVID-19 containment measures when schools reopen in January 2021.
The provision of desks in schools to be able to achieve an element or a degree of social distancing. So that program is going on very well, and the government is full control of that program. But it must be hand washing stations in every school. That is something that the government will not be able to compromise on.
Meanwhile, Chief Officer in charge of health in the Nairobi Metropolitan Service, Ouma Oluga, has called on striking healthcare workers to resume work as the government seeks ways of addressing their grievances.
Of course, there is a lot of effort that is being put under the leadership of the Ministry of Labour to address all issues. I think their leaders should confirm to you that they have been attending meetings at the Ministry of Labour, because I have been part of those meetings myself, and it is not, therefore, not true that they have been ignored.
Nancy Okware, Channel 1 News.